Hello and welcome to today's Stroke Matters podcast. My name is Lauren and I'm a StrokeLINK nurse in the Mater Hospital.
Hi, I'm Melissa and I'm also a StrokeLINK nurse here in the Mater Hospital.
With over 40 years nursing experience combined, we have a strong passion for stroke prevention.
In today's episode, we'll be discussing stroke prevention, including risk factors, lifestyle changes, and the importance of monitoring blood pressure.
Stroke remains a major health issue worldwide and here in Ireland. According to the Health Service Executive, around 7,500 people experience a stroke in Ireland each year, and it's one of the leading causes of disability.
The positive message, however, is that up to 80% of strokes are considered preventable through lifestyle changes and good management of medical conditions.
Let's start by briefly explaining what a stroke actually is. A stroke occurs when blood supply to the brain is interrupted or reduced, preventing brain tissue from receiving oxygen and nutrients.
And there are two main types of stroke. The most common type is an ischemic stroke, which accounts for about 85% of strokes. And this occurs when a blood clot blocks an artery supplying the brain.
And the second type is a hemorrhagic stroke, which happens when blood vessel in the brain ruptures and causes bleeding into the brain tissue.
And it's important to note that both types are medical emergencies and that early recognition and treatment are essential to minimise any brain damage and improve recovery outcomes.
Absolutely, Melissa. And a simple and effective way to recognise stroke symptoms is by remembering the BFAST test.
B stands for balance. Has the person had a sudden loss of balance, or are they experiencing dizziness or a loss of coordination?
E stands for eyes. Has the person experienced sudden blurred vision, loss of vision, or double vision?
F stands for face. Ask the person to smile. Does one side of the face droop?
A stands for arms. Ask the person to raise both arms. Does one arm drift downwards?
S stands for speech. Is their speech slurred or difficult to understand?
And most important, T stands for time. If you notice any of these signs, it's time to call an emergency services immediately.
It's really important to remember prompt treatment can significantly reduce disability after a stroke, which is why public awareness of these signs is so important.
Let's chat a little bit about risk factors. Knowing your risk factors and managing them can significantly reduce your risk of a stroke or a second stroke. Stroke risk factors can be divided into two categories: non-modifiable and modifiable risk factors.
Non-modifiable risk factors include things like your age, your genetics, your sex, and having previous stroke or transient ischemic attack, also known as a TIA.
However, many of the most significant risk factors are modifiable, which is really positive, meaning we can actively manage them.
Modifiable risk factors can be broken down into two categories: medical risk factors and lifestyle risk factors. Let's have a look first at medical risk factors.
And the most important of these is high blood pressure, which is also known as hypertension. It is considered to be the single biggest risk factor for a stroke.
Yeah, and another important medical risk factor is high cholesterol. We would always recommend speaking with your GP and arranging a plan for routine cholesterol blood tests and monitoring.
And if you've already had a stroke, it is important to speak with your stroke doctor to find out what level they would like your cholesterol levels to be. Your GP can help you achieve and maintain this.
Yeah. And another risk factor associated with stroke is a medical condition called atrial fibrillation, which is an irregular heart rhythm that increases the risk of blood clots forming and travelling to the brain.
With atrial fibrillation, it's really important to be fully informed if you've been diagnosed with it to ensure that you're participating in good medication compliance and arrange to see your GP for regular checkups.
Really good advice, Lauren. Yeah. So now let's look at lifestyle risk factors. Lifestyle risk factors that are modifiable include things like poor medication compliance, smoking, diabetes, obesity, physical inactivity, and excessive alcohol consumption.
Yeah, and another is also poor insight into your own health conditions. This is why regular checkups and chats with your GP about your health is extremely important.
Yeah. We mentioned a moment ago how high blood pressure is a risk factor for stroke.
And because high blood pressure is such a significant risk factor, regular monitoring at home is essential.
In fact, many people now monitor their blood pressure at home using a validated blood pressure monitor. Home monitoring can help detect hypertension earlier, and this allows patients to track changes over time.
It absolutely can, and it also helps healthcare providers assess how well treatments or lifestyle changes are working.
When measuring your blood pressure at home, patients should try to sit comfortably, rest for a few minutes beforehand, and take readings at the same time every day if possible.
And it's important to note the time of day that you are checking your blood pressure and also what time you took your medication. This is valuable information for your GP or medical team to know.
Yeah, and it's also really important to speak with your stroke doctor or your GP to establish with them what your own safe range of blood pressure should be. So ask them, what are my numbers?
Exactly. And if your readings are consistently high or above those numbers, it is important to contact your GP or healthcare professional for further assessment and management.
Absolutely. And you can check out our website, www.strokelink.ie, for more information on self-monitoring your blood pressure at home.
And on the website, you will also find a video showing how to use a blood pressure machine.
That's right. Then looking at lifestyle changes to reduce stroke risk. Alongside monitoring blood pressure, there are several evidence-based lifestyle changes that can significantly reduce your stroke risk.
There is, and first is healthy eating. A balanced diet that includes fruit, vegetables, whole grain, lean proteins, and healthy fats can all help control blood pressure and your cholesterol levels.
That's right. And the Mediterranean diet has been identified as a good tool to follow to help you introduce healthier foods to your diet.
It is, and later in the series, we will be joined by our very own Mater Hospital stroke dietitians who will provide detailed advice and information on how to eat healthy. Be sure to keep an eye out and have a listen.
And I'm really looking forward to listening to
Yeah,
that one, Lauren.
me too.
Chatting with the girls. Also, reducing salt intake is particularly important. High sodium consumption is strongly linked with increased blood pressure.
And regular physical activity is also key. Current recommendations suggest that at least 150 minutes of moderate physical activity per week, such as a brisk walk, cycling, or swimming.
And also, if someone smokes, quitting smoking is one of the most effective steps they can take to reduce their risk of stroke.
It sure is. And also, limiting alcohol intake is also really important, as excessive alcohol consumption can raise blood pressure and increase the likelihood of a stroke.
Exactly. In addition to lifestyle factors, proper management of underlying medical conditions is also essential.
This includes taking prescribed medications for conditions such as hypertension, high cholesterol, diabetes, or atrial fibrillation.
Yes, and regular follow-ups with healthcare professionals allow for ongoing monitoring and adjustment of treatment plans if needed.
And for the patients who have already experienced a TIA or a stroke, these measures are particularly important for preventing reoccurrence.
So throughout this series, we'll be discussing many of the risk factors in further detail, and we'll be joined by many of our Mater Hospital stroke colleagues. They will provide further detailed information on how to prevent stroke or a second stroke.
They will, and we'll also be discussing many hidden stroke symptoms that many stroke survivors may experience.
These symptoms may include fatigue, changes in mood, frustration, and poor concentration.
We will also be chatting about life after a stroke, and we will help guide you to returning to living well after a stroke.
Yeah, so to summarise, stroke prevention focuses on identifying and managing your risk factors early.
Monitoring blood pressure, maintaining a healthy lifestyle, managing medical conditions, and attending regular checks with your GP can all significantly reduce stroke risk.
And of course, remembering BFAST signs can help ensure that anyone experiencing a stroke receives urgent medical care.
And remember that stroke prevention is a shared responsibility between patients, families, and healthcare professionals. So be sure to link in with your medical team and your GP regularly.
Absolutely, yeah. So thank you for listening to today's episode.
We hope this discussion has helped increase awareness about stroke prevention and the steps that we can all take to protect our brain health.
And we really look forward to our future guests and hope you enjoyed the series. And always remember, stroke matters and you matter.
This podcast was brought to you by StrokeLINK. I'm Lauren McDunphy.
And I'm Melissa Gannon.
Make sure to follow our podcast series on Spotify, Apple Podcasts, or wherever you download your podcasts to learn about living well after a stroke.
If you like this podcast, please like and share it with family and friends. You can learn more on our dedicated website, strokelink.ie, where you will find an array of information and content written by stroke healthcare professionals, along with information on community supports and services. StrokeLINK podcast was brought to you through the support of the Mater Hospital.